You're listening to the Pasco Podcast with Mike Carballa. Welcome to Season 3 of Pasco Podcast, a series about leadership and public service. We'd like to thank our sponsors, the nearly 600,000 people of Pasco County, as represented by the Board of County Commissioners. It's through their trust and empowerment of our workforce and leadership team that we're able to bring you this podcast. This podcast is designed to help public servants build leadership skills and leverage them for success by sharing the experiences of our peers.
Hi, I'm Mike Carballa, and welcome to our 54th episode of Pasco Podcast. September is National Recovery Month, a time to honor the journeys, struggles, and most importantly, the hope that comes with healing. In Pasco County, recovery isn't just a word, it's a commitment that's shared by our Fire Rescue Mobile Integrated Health Team, our partners at BayCare, and so many community champions who show up every day to make a difference. Joining me today are Pasco Fire Rescue's Eric Munroe and BayCare's Sonya Bufe. Sonya, Eric, welcome. How are you guys?
Hey, doing well. Thanks for having us. Yeah,
that's great. Well, I'm glad you guys could be able to make it here. And so, we were just talking before the podcast. Hey, Pasco is the place to be. So, Eric, how did you come to Pasco County?
My Pasco journey was not very far. I grew up in the Bay Area, so born and raised down in West Tampa, Town and Country.
Okay.
So I came up here about 18 years ago when I met my lovely wife. Moved in Land O'Lakes and been here ever since.
Very good, very good. Just joined the fire department, or?
Yeah, so before I joined the fire department, I was living in Land O'Lakes. Went to the fire academy, put out a couple applications, got picked up by Pasco, and been here ever since.
Rest is history.
Yeah.
So Sonya, you're a resident of the areas too here around, but talk to me about how you came to do what you're doing and how you ended up working here in Pasco County.
So I've been in the behavioral health field since 1997 in the area. I was lucky enough to join BayCare in 2017, and I've been in Pasco since 2017 and love the work.
Very good, very good. And so your job title is?
Clinical manager.
Clinical manager, and yours is?
I supervise the MIH Mobile Integrated Health
Mobile
team.
Integrated Health. That's a lot of alphabet in there. So
it is a lot. Yeah,
talk to me about what exactly you do, Eric, and Sonya. I'll come to you next.
Yeah, so I oversee the MIH program, Mobile Integrated Health, MIH. So what Mobile Integrated Health is, I know it kind of is a mouthful, but basically the big push is the access to care to individuals where they are. So that's what my team does. We're a team of medical professionals. We got community paramedics on the team. We got social workers and a nurse practitioner on the team. We go and we meet people where they are at to deliver them that health care or social needs that they may have. So obviously it involves a lot of community partners like we have here with BayCare. We are still a relatively small team and growing. There's 17 members now. Mm-hmm. So we rely on working with our community partners, BayCare, other agencies out there, and even within the county too, human services out there.
It's a handful, right? Maybe we'll get into it a little bit later to talk a little bit about, maybe specifically give us an example of how that works. But you guys are meeting people where they're at. I think it's a fantastic idea. I think we approved this in the budget initiatives. Maybe it was last year, or year before. So it's still relatively new, I think. And we're, just doing a lot of great things. So we'll come back to that.
Right.
How about you, Sonya? What's your role in all of this?
So in my role, I actually oversee community partnerships in the community. So I work with Pasco County Corrections. I work with Pasco County Fire and Rescue. We work with local law enforcement and many other organizations. No 2 days are the same.
Right.
We have a team of peers, people with lived experience who are actually helping people to get into recovery,
Gotcha.
Case managers, therapists, and just doing the work in the field to actually bring people into services.
That's fantastic. As I mentioned before, September is Recovery Month, right? So talk to me a little bit about what recovery means to you.
I grew up in a family with substance use and mental health, so I knew very early on that this was a field that I was very passionate about. So recovery is helping others to not have to repeat the experiences that I had in my life and help them find hope and peace.
Wonderful. How about you, Eric?
Yeah, I think recovery, it touches us all. I know I had a lot of friends in high school that unfortunately, succumbed to a lot of substance use disease disorders. So it really, hit me close to home. And, I think it hits a lot of people too. It kind of resonates. So my team is there to kind of just lift the burden off, the individual that needs the help, the family, and just be there for that support.
Yeah, no, it's fantastic. It's great work, and I mean, as folks recover, it symbolizes a journey, and it is a journey in a lot of ways, right? Because you're kind of always in recovery. I think is really kind of how it's termed out. But just appreciate that great work that you all do. I know it's hard, and you say not every day is the same, good or bad, I suppose. You both were involved in Pasco County's Opioid Task Force, and for those that don't know, that was basically a settlement, came out of a settlement agreement, with various parties related to basically the opioid epidemic that was seen, and so those monies are coming back to local governments to do good work. What role did you each play, or at least your organizations play, on that task force, and how do you guys collaborate? Talk to me a little bit, Eric.
Yeah. So even before the OTF funding and project, we had the opportunity to work together with the core project, which came down about 3 years ago, with some of those other abatement funds coming through DCF, DOH. So we had a partnership and relationship already built. What the OTF allowed us to do is kind of expand our team. When I talked about the new team members that we brought on, that afforded us the opportunity to get our nurse practitioner on there. I was just talking today, we got a couple more vehicles, we're outfitting them so we can, the goal is to give the access to care so our team can treat in place, whether it's medications or whatever they may need medically, socially, we'll be able to do it in place. And then the goal is to hand it off to some of the treatment centers, whether it's BayCare or whatever other services they need. Primary care.
You're reaching out to them, before they end up in an ER or worse, or those types of things, right? So that's part of it. Is and I mean, how do you get your leads? I mean, how do you know that, hey, we need to be going here?
Yeah, so that's the fortunate thing that we have at Pasco Fire Rescue is that our frontline crews are out there running the calls. They're engaging with the individuals. They're running that acute overdose call or substance use call, and they're identified. Our team is able to capture those calls on the backside, whether it's a crew referral or it comes through our electronic patient care records. We are able to screen those calls, and then we go out there. All of the people that are referred to our program, we go out there. We do an in-person visit with all the telebots remote calls. Okay. Nobody can trust. We want to ensure, our team is out there, and it's been a great response. We've been doing it for 3 years now, and everyone is, some of them, they know us now by face, but at first they're like, the fire department's never come to check on me before. So kind of gives me goosebumps, like, that feeling,
it's a proactive approach. And
feeling appreciated and, a group of medical professionals out here to, help you with your medical needs. It's cool to see.
Wonderful. Sonya, how also, talking about opioid task force, thoughts and impressions on that?
Yeah, the opioid task force has filled a lot of gaps. So services that maybe were lacking or we, needed to enhance, the opioid task force has done that for BayCare. So we've expanded our coordinated overdose response, our Pasco response team, and we've also been able to build the first behavioral health urgent care in the state of Florida.
So let's talk about that. Yeah, that's exciting. That's just down the street, right?
It is.
And kind of a first of its kind. I mean, it's a game changer in my opinion. What does that mean to you personally and kind of for Pasco County?
So we've treated individuals from a medical standpoint in urgent cares for many, many years. Someone that has an urgent need, maybe should not go to an emergency department, but can't wait for routine services. And from the same standpoint, from a behavioral health standpoint, if they have a mental health need or a substance use need, they have those same day services that they can go in, see a case manager, a therapist, a medical provider to get those needs met. So it's been
huge.
Wonderful.
I mean, that's so huge, right? I mean, for most people, I know it's like, well, if I wanted to go get some mental health, and I'm through my employer. Okay, we'll call this number. Okay, get a referral. Okay, it's going to be 3 weeks. By then, who knows, right? So, being able to provide care now, urgently, it saves lives. I think I would argue. I mean,
I agree. Yeah. Crisis diverted.
Fantastic. So, for listeners who might not be familiar, how would you describe the mission and role, Eric, of the Mobile Integrated Health Team? I think we've kind of hit on a lot of these concepts, but let's just get right to the point on it. I mean,
one of the things I think is just empowering that person where they're at. I mean, that's what our team's there to do. They have to buy in. We have to build them up. We have to empower that person. So I think that's a big message that we like to do. A lot of the people that we see, these high risk individuals, I mean, after they've been transported to the hospital. This is not like, this is, probably some of the lowest points in their life. Yeah. So I think that empowerment, building people up is the mission. We're there to support them. We have to build that trust with them too. Whether they've been burned, through the healthcare system or whatever route, we got to build that trust up in them and then ensure them that we're there to help them. And then working with great community partners like Sonya and her team over there, I can't say enough great things about them.
So maybe walk me through an example of where you would do some work and how you would collaborate with BayCare and bring everything together.
Yeah. So we got great contacts through BayCare. So when we go out and we engage with those individuals that I talked about before that we identified, we'll go out there, engage with them, try to build up that rapport. Our team will lay some of the groundwork down. And when they're ready, we have a great contact over there. We have peer supports, their case managers to try to, if they're willing to, they can come out and engage. They can come out and do some of the paperwork on site. If they need to go over to the clinic, we can get them there. So whatever's comfortable for them, right? If they don't want their family member to know about this or that, or their neighbor, okay, let's get you over here and we won't look so busy out here, or vice versa. Some of these people don't have those means of getting around, or they don't want to, and we can bring the care to them. So that's when we do those warm handoff to Sonya and her team. And, it's been great. I mean, over the 3 years, we've really ironed out the processes, and, it's almost like we're part of the same team. It's fluid. And
gotcha. So you guys are kind of handling more that acute end, and then you kind of take care of more of the long-term kind of things, or that handoff. Talk a little bit about your all's role in that handoff, just to use those words.
Yeah, so if we receive a referral, or if we're working on site with Eric and his team, we'll engage that individual, we'll assess them and see if they're interested in services, what types of services they might need, whether that's BayCare or another organization. And then we'll work to coordinate that care, and then we follow them for a period of time to make sure that they're continuing to be engaged, that any ongoing needs are met, and just continue to support them. Support is important.
Yeah, well, support is important. So let's talk a little bit more about support. So obviously, staying engaged is one way. What about Mobile Integrated Health Team? Are we, if it's a year later, how are we maintaining that support? I'm just curious.
So we support. So our mission is, we want to go out there and we want to treat for usually 30 days, or not everybody reads the book and needs the same thing, but we're doing check-ins. We're doing 30, 60, 90-day check-ins.
Okay, that's great.
So especially with, our software, it alerts us like, hey, we need to reach out to so-and-so today. So it's great to be able to follow those people. And they have our numbers. We leave them our harm reduction kits. They have all our pamphlets and folders. And, we want to ensure and set them up for success. But when we talked about empowering too, we got to, they got to take responsibility for their healthcare too.
Oh, of course, 100%. But I think as you point out, it's good to know that there's support, right? There's somebody in fire rescue. There's somebody from BayCare that's actually cares and actually, cares about what it is in my recovery, in this journey. And I'm sure you probably talk to people that, get back the wrong way, and then there's others. I imagine it's got to be exhilarating when you see them moving down the right path. Any thoughts on that? Any stories maybe you want to share?
It's not a linear process. People are very much moving at their own path.
Correct.
And it's not a 8 to 5 Monday through Friday type of thing. And so we have 24/7 numbers. We have on call so that individuals who are struggling, later in the day or even in the evening can reach out and know that someone is there for them and that they are able to get some assistance. And so that's been very, very positive. People have said they've been very appreciative of that.
That's fantastic. Anything to add to that?
Yeah, I think too. We just, we don't judge. And I think that's the main thing. If we had to go out to an individual, I can think of a handful that, they have had a couple missteps along the way, and we come back out and they see us and they know, and they kind of, we do these looks, and we're fortunate. I think, fortunately, one of the ones that was having the back and forth, he finally got back in the program. So I was, very glad to hear that again. I was talking to one of the peer supports, so he's back in the program. So I'm like, cool, but we know it's the ups and downs, and I think it's some of these lifelong journeys. It's gonna be with somebody for a while.
Well, how do you guys stay connected, to the community to understand their needs? We have the 911 calls. That part's obvious. But when we're not on the 911 calls, how do we know what the next thing here is that the community needs? Any thoughts on that?
It's a lot of collaboration. task force and trying to get people to tell us what they need, because we don't know what someone needs.
Right.
And so those conversations, reducing stigma, the language that we use, making sure that if someone has a need, that we're creatively coming up with a solution for that and not just doing a one-size-fits-all kind of answer to that.
I want to come back to that in a second. Eric.
Yeah, I don't know, when I hear about the stigma too, it's like, we're kind of beating that drum, and especially when they see the fire department come out, we're teaming up with BayCare. When we go around to the hospitals, my team, they're engaging with the hospital staff, they're engaging with our frontline crews. So I think, everyone starts to buy in and, knocks down that stigma. I don't know what it is sometimes with, the fire rescue badge. When we go in there, I think people perk up a little bit, and it's been amazing to see what we've done in 3 years. So it's hard to believe, but it's awesome to see.
So talking about that stigma, I get it, right? If you're looking to try to get into recovery, you've maybe there's feelings of shame, guilt, whatever emotions are overcoming you. That's one thing. To be able to step forward and feel like you've got support. But what about education for the rest of us, right? For folks that may not even know better, they're they charted their own course. People I don't think really understand the power of addiction and how really hard it is to recover. Any thoughts on community education and outreach that maybe we should be doing just with your general population? Because quite honestly, they can support others to try to take advantage and recover. And we all make mistakes. So.
Yeah. Similar to any other disease, addiction is a disease. And so like a heart disease, the signs and the symptoms, what to do if something is, you see something. And so to educate the community about what those signs and symptoms are, how to have conversations with people, just to be compassionate. Everybody's walking their own journey, and you don't have to know the answers, but to at least let someone know that you're there is very important. It's very helpful.
Cool.
Yeah, and I think that is very helpful too. And I can imagine, because I've had friends and family that have been affected by substance use, and it gets taxing on the family. So when they can't when they get taxed out, that's what is kind of I think cool about our teams is we come in, hey, let us pick up the slack a little bit. And try to guide your loved one in there, and it's relief to the family too, and the education too, showing those signs and symptoms, and then even some of the harm reduction efforts too. We go out there and we empower the families. Yeah. We give them Narcan so that they can feel like they can empower themselves. If their loved one overdoses again,
something I can do in the moment at least,
empower the family member, whoever it may be. So. I think it's something cool that we do. And then we give them a lot of the resources too. We connect them with some family services. If it's something for the family, or if it's the person wanting to engage, we help them too. So
maybe I don't have an addict in my life or someone that's under recovery. Is there anything that you think our listeners should know when it comes to addiction, recovery, or just helping someone in a crisis in general? Any tips?
Yeah.
I don't know.
So I've worked in the field 30 years, and the only thing constant is change. So not thinking that you know everything just because you knew what was going on 10 years ago. Fair. And so really staying on top of the current trends and what exactly is going on. So teenagers are very, slick. And so oftentimes we have to
They seem to be getting slicker and slicker. I don't know.
We have to know exactly what to look for. And so, just kind of understanding what is the current trends is important.
Gotcha. What about you, Eric, from your perspective?
Yeah, I think the current trends and the current treatments too, because I diving in 3 years ago, my specialty was always emergency medicine.
I never even heard of Narcan until 3 years ago.
Yeah,
right?
Well, I knew
I'm under a rock, I guess.
Narcan was emergency medicine, so we knew how to treat this acute overdose.
Right.
But some of the long-term treatment, when it comes to the best practices, some of the buprenorphine is some of the gold standards to really engage people and decreases mortality and increases their engagement. So that's I think some of the gold standards for treatment have even changed. So somebody that was suffering 10 years ago might be like, oh, that wasn't for me, but the options have changed, and some of the programs might have changed as well.
Oh, fantastic. So, you've worked in this business for quite a long time, both of you. You've got teams. Some are new members. I'm sure you've got seasoned members. And like any job, there's repetitive stress, right? Every day is different. And I can imagine that you face some very emotionally intense situations. So talk to me a little bit about how you guys as leaders in your organization keep your teams motivated and focused to keep at this, because every situation is different. Every person, you're touching touching a life, one life at a time. Talk to me a little bit about how you keep your teams motivated, not really getting burned out on this or getting jaded, quite honestly.
We do a lot of training on compassion fatigue and really self-care and self-awareness. We also laugh a lot. As stressful as it is, it's also very empowering to hear a success story, to share that with the team. And so we laugh and we talk about the success stories. And then when we are burned out or, fatigued, then we have those conversations as well.
Yeah. Okay.
Yeah. I think that's a big thing that I don't want my team to encounter too. So we try to keep it light, I feel like I have a pretty jokingly personality, so I enjoy a good laugh. But these cases get heavy sometimes.
Yeah.
So it is, easy to get too close to some of them too. And it, for me, kind of overseeing the operation, I want to make sure like if I notice somebody is maybe getting a little too close, or you can, some of the body mannerisms or some of those.
Right.
You don't want your team members to fall into it. We keep it fresh with other things too. We do community outreach, so it's not just completely client engagement with some of these high-risk individuals. So we do our community outreach events.
Okay.
I encourage all of our team to sign up for some of these committees, go out there, talk to the community partners, talk to the crews. So really try to keep it fresh, but it gets heavy. I mean, some of these situations we go into, when you go into some deplorable situations, and you want to do so much, but sometimes you're limited.
Well, I know with our first responders too, through partnerships with BayCare and things, we've tried to make mental health resources a priority too for our team members, and in order to kind of talk through that stuff sometimes, because it's pretty heavy. But I mean, I imagine there's some rewarding parts too that come with it. Eric, can you share with me maybe something impactful, maybe some a moment where you really you felt especially connected to the work that you were doing?
Yeah, I mean, I think almost every day we have, great stories. I mean, even, we get phone calls, from families that we've helped and persons. Our team, they do great things out there. It's amazing. Our team, with the OTF funds, they're relatively new. They're coming on in January, but they're able to find persons living out of their house that are suffering, get them into a stable housing unit. We stumbled upon one of our clients that we followed up with a lot. He was overdosed at his home, and the family wasn't even aware that he had overdosed. His elderly aunt had thought he was just sleeping. So if it wasn't for our team getting there, he was, almost apneic compulsus by the time we got there, and we were able to revive him. And so, it's pretty cool.
Yeah. What about you, Sonya?
The secret sauce for recovery for us is the individuals with lived experience. So I have several individuals who have gone through programs, then become a recovery support specialist, and then done the work with the individuals that are new into, and now they've become case managers and even therapists. So just to see that growth and to know that great. Recovery is being lived is wonderful.
Yeah, it's being lived, and those folks are kind of given back too in a lot of ways, and I'm sure that's even more rewarding. You guys, we've done some great cross-agency partnerships, so there may be groups out there kind of interested in trying to build those relationships. Any advice you'd give them?
Yeah, come to the table.
Yeah.
Show up. That just like the ripple effect, small steps actually have big results. There's a lot of committees. If you want to just reach out, we're happy to connect you. And we're welcome to anybody who's willing to help.
That's awesome. Eric?
Yeah, I think it is those small steps, building these partnerships through the community are super important. We started off with a small team. It was Glenn and myself who started this a couple of years ago, and now we've grown to 17 members. So just small steps, and eating an elephant one bite at a time, I think they say. So some days I have to remind myself of that, but
well, that's true. Well, as we dine on this elephant, Eric,
yes.
I guess what are you most hopeful for when it comes to looking at the future of efforts like this, and especially as it amounts to recovery in Pasco County?
Yeah, I think we're really clicking on all cylinders. The last thing for our team is getting that treatment in place to be able to offer them that medication. We have the program set up. We have available bed spaces for sober living and the urgent care clinic. If people want to engage in these services, we have them here in Pasco County for our residents, which is super cool because I live in Pasco, working for Pasco Fire Rescue, super passionate. So it's awesome to see that we are able to provide these things for our citizens.
Cool. Sonya, what's the future look like to you?
Yeah, I feel like we have some really great quality services. I would like to see us get upstream more, do some more prevention, some more education, and prevent the issues that we're seeing, and maybe even work ourselves out of a job. That would be wonderful.
Wouldn't that be great? You know, it'd be nice if we could focus on other things in this, but it's here with us. And, you know, God bless you guys for doing the work. It truly is yeoman's work. So thank you for that. So I just appreciate you guys being here. You know, I think it was great. So special thanks to our media relations team who make this effort possible. And thank you for joining us on this episode of Pasco Podcast. I'm Mike Karbala, and we'll see you next time.